Good morning, and thank you for inviting me to talk about innovation at Sheba Medical Center. Let me start by introducing Sheba Medical Center. Sheba is the largest hospital in Israel, actually one of the largest in the world, very comprehensive in terms of medical treatment, scoping everything from acute care to rehabilitation and children's hospital and cancer and heart center and so on. In terms of numbers, Sheba, as I said, is one of the largest, and the numbers speak for themselves. We won't go through them, of course, but very large in terms of emergency visits, of numbers of doctors, and also number of startup companies that are coming out of Sheba, as well as part of our global ecosystem, which of course I'll describe to you over the next few minutes. Another thing to note about Sheba Medical Center is that Sheba is a very digital hospital. It has been so for many years. Actually, our last department to go digital was our emergency department back in 2004. So since then, we've been completely paperless, which means huge amounts of data that are stored in a data lake that we take care of course, within Sheba. And that's, of course, a source for much of the innovation that I'll be speaking about over the next few minutes. Sheba was also ranked as one of the top 10 hospitals in the world on the Newsweek ranking for 3 years in a row. We're very proud of that achievement, and innovation and research have been one of the main reasons that ranked Sheba so high on that list. Before we're heading towards innovation, we need to understand what's the goal, what's the aim, where are we aiming, or what would be the future of healthcare? If we're going to redesign healthcare, we need to understand to redesign towards what. And to do that, Sheba has started an initiative back in 2018, originally called the Future Hospital, but then changing its name to the Future of Health, looking at a broader scope. In this initiative, we're bringing together healthcare leaders from around the world who come in to speak about and discuss the future of healthcare, to put forward a blueprint of how we see the future of healthcare play out. We're meeting about 3 times a year. We're trying to meet once at least physically when COVID permits, of course. And we've been doing that over the past 4 years, coming with some very concrete understandings on where healthcare needs to move and how do we get from here to there. We've actually published some publications on that as well in scientific journals. But once you have that vision together, obviously innovation will need to play a central role in making that vision a reality. So when we talk about the transformation that healthcare is about to undergo, we often talk about telemedicine, of course, which through COVID has gotten a real boost. And I don't need to explain to this audience why telemedicine is critical as we move forward and we move into virtual care and not just physical care, but also artificial intelligence, which will help us make the right decisions and be much more efficient, much more effective in our treatment, get it right the first time without trial and error, as many times medicine is all about. And so that would play a critical role as well. Virtual reality, augmented reality are going to help us redesign healthcare in many ways and forms in terms of better surgery, better education, rehabilitation, treatment for pain or anxiety, and many other problems that we're addressing right now. And it's going to grow in size considerably over the next 10 years. And finally, robotics, not just in the surgical room, where robotics will become more autonomous with time over the next 10 years, but also robotics in the healthcare environment, carrying many tasks that today are carried by people and being much more effective and efficient. All of that requires tremendous amount of innovation. And that is the reason why we've decided to launch our innovation platform in 2019 called ARC. ARC stands for Accelerate Innovation to Redesign Healthcare through Collaborations. And ARC has a single aim in mind, and that is to redesign healthcare by the year 2030. I know it's quite ambitious, and to do that on a global scale obviously takes it to another level, because we're not just satisfied with the implementations here specifically at Sheba. To do that, you have to build an ecosystem. No one hospital or one institution can do this alone. You have to work with partnerships. And this is what we've been doing over the past 3 years. ARC has 4 fundamental principles. The first one is a focus on digital health. I think that's obvious today, especially as we're going through COVID, to understand why the digital transformation will be one of the main transformations in the healthcare industry. Healthcare is next in line to go through digital transformation. And if you're going to redesign healthcare, you have to focus on digital health because, again, that would be the main driver for that transformation. Second is open innovation. Academic medical centers typically focus internally to create their own patents and then take that to the market and create innovation. But we think that it's not just about internal innovation. You have to have internal as well as external, as well as open innovation. You have to lower the barriers and allow innovation to come in from the outside into your organization as early adopters, as design partners, or in many other models. But innovation from outside needs to find itself in, and that's not always taken for granted. The third is international collaborations. As we're looking to have a global impact, as we're looking to collaborate, as we're looking to look for added value, we need to build an ecosystem. You'll see how that ecosystem looks like right now with more than 120 members worldwide that are part of the ARC global ecosystem. And finally, it's the innovation infrastructure. It's what is needed to take innovation to the next level. And it's not just the physical space, it's also the policy and regulation and data infrastructure and funding infrastructure that will make all of this work. And we'll say a few words about that as well. When we talk about startup companies at ARC, we have about 80 of them. About half are coming from within Sheba, from our own internal innovation program, which I won't have time to talk about today, a very robust program that launches about 10 startups every year based on patents discovered and registered from within Sheba. Then the other half are companies from outside, the open innovation aspect. These are the best startup companies we identify, bringing them into our ecosystem, allowing them access to everything around, and really building a 360 degrees model that provides everything these startups need to accelerate innovation and provide them direction towards the market needs. We also invest in companies, and these companies become part of the ARC ecosystem as well. I'll say a few words about investments. In terms of international collaborations, we work with the leading academic medical centers around the world, mostly in North America, as you'll see on this slide. We won't go through the names, but the idea here is to look for other innovative academic medical centers that share the same mindset, that share the same vision of the future of healthcare, that are seeing innovation as a strategic emphasis within their own organizations, and then working together, again, to look for these added value opportunities. Look for those opportunities where 1 + 1 = 3 and not just 2. If we can make that happen, we can actually move things ahead in terms of the redesign and the transformation that is so much needed. And there's tremendous amount of collaboration that happens with the names you see here on the slide, and we're looking for more partners to grow this ecosystem and increase the value we can provide to each member. We also work with the industry, leading strategic partners in the industry. You see the names here with different models of co-innovation and co-development. We share data, we run pilots together, and this is working exceptionally well. It's a bit different with each company, depends on the needs, but the idea is to look for innovative models of public and private partnerships that will bring a win to both sides. And it's also a challenge. In terms of the infrastructure, it's not just the physical infrastructure, and you're seeing here how ARC looks like today, but it's also, as I mentioned, the policy, which is critical, the regulations that we can actually impact as well, the funding infrastructure, which I'll say another word. And also when we talk about the physical, this is the new ARC building. We're going to start constructions very soon on. This is going to be a huge building, 22 floors, as you can see here, branded ARC. And the idea is to bring many of our partners into this same space under the same roof so that we can work together to create that added value I was talking about before. When we talk about funding infrastructure, we have 3 investment funds within ARC. And these 3 investment funds are anything from a pre-seed, investing about $500,000 in a company, all the way to round A, investing about $5 million in a company, and everything in between. Already these funds have made substantial investments. You see some of the companies here on the slide, and they're critical as we want to push innovation forward, because as you know, a great idea without the proper funding will not be able to make it and have that impact we're looking to have. Just the startups coming out of Sheba in 2021 have raised $110 million in 2021 from our funds and, of course, other funds as well, with a total of $1 billion raised over the past 15 years. And just comes to show that at the end of the day, these innovations that are coming out from within the medical center are actually making it in the market. Many of them are actually having products out that are helping transform healthcare as we know it towards that redesign we're looking to have. Since we have a very structured program for innovation, we are able to take that program and implement it within other academic medical centers around the world. We're doing this right now with 3 sites in Canada, in the US, and in the UK, and we're building ARCs, the same concepts of innovation, applied to other academic medical systems, of course, after we learn the environment and what can be applied and what needs to be modified. And this is a model that's actually expanding right now. We're getting more requests to do this type of work, and we're happy to do it because it extends, of course, the value provided by the ARC network. As you can see here, just the experience from Canada, this is from Forbes just last month, weighing in on Canada's economy in 2022, and you would see that Ottawa's hospital partnership with Sheba Medical Center actually was mentioned as affecting Canada to become more attractive for investments and create skilled jobs and growth in the economy. So definitely we're seeing already an impact and at least the mindset of where this has the potential to grow. We have other international projects that we're very proud about. One of them is building an innovation center and accelerator program for more mature startup companies, most of them coming from within ARC, that we're going to open in Chicago. You see here how this is going to look like, and this is the space where constructions are now beginning on very central location in Chicago, very high level project, which also has an aim to improve health equity, to decrease inequities in healthcare, and provide better access to care, better effective and efficient solutions to areas in Chicago that are not enjoying the best healthcare at this point, with huge gaps, for example, in life expectancy between different neighborhoods in the city, as I'm sure some of you know. So this accelerator and innovation center has that specific aim to improve health equity within the city of Chicago and the state of Illinois. We're very proud about this project. Another project, very interesting one, we recently signed in New Jersey, being part of a project of building the city of the future. It's called SciTech City, and Sheba has been chosen as the healthcare partner to build that health city of the future. And we're actually open a demonstration lab to demonstrate the technology of healthcare in the future and how that is going to impact care and health 10 years from now and beyond that. That's another exciting project that we're just launching in New Jersey. And also, of course, closer to home, we're very much conscious of trying to bridge gaps within our own society in Israel. And one of the things we've done is open an ARC in Kfar Kasem, which is an Arab town about an hour away from where we are at Sheba. And this ARC in Kfar Kasem is aimed at building startup companies from the Arab community in Israel, the Israeli Arabs, and spin out companies in healthcare that could have an impact, and we hope, on the future of healthcare. You're seeing here on the slide just the first company that won a reward we put forward earlier in 2021. Well, I cannot finish without saying a few words about COVID. Of course, we're still under the influence of COVID, and basically what we've done when COVID started back in March or February of 2020 is we went into what we call the ARC battle mode COVID-19, which basically said that ARC is now completely focused on solutions for COVID. This was the aim. This is what we set out to do. And for 4 months, we were completely focused only on solutions for COVID. And we came up with a very large number of solutions. I won't have time, of course, to describe that to you. Maybe some pictures here to give you some understanding of what the setting looked like. But at the end of the 4 months, it was about 43 inventions, from which 13 we patented, and 3 startup companies that were launched during that time in the space of diagnostics and therapeutics, some of them having an impact already and have a very bright future ahead of them, I think, not just treating COVID, but maybe treating viral infections in general. So in just 4 months, tremendous amount of innovation through partnerships we have built and the mindsets and methodologies of ARC being put to the test in times of crisis. And I think it proved itself to be very, very effective in that period of time. So this is the entire ARC ecosystem, as you see here on the slide. We're trying to work together, very, very coordinated, both in terms of putting the vision together. It's not just about Sheba deciding on the vision, but it's about all of us getting together to define that vision of the future of healthcare and then working together to implement. As you know, implementation is critical because at the end of the day, we want to have that impact. We want to be able to redesign healthcare and provide better care to our patients, much more patient-centered, much more value-centered. And this is where ARC has been going over the past 3 years and moving ahead on an accelerated mode in the years to come. So with that, I'll finish my talk. I'm having my contact details here if people want to reach out. We're always looking for more collaborators. I hope this was helpful for the audience at the conference. Thank you very much.